Hi, welcome. This is the Mental Health Association New Jersey, Atlantic County's Community Education Monthly Workshop. And today we're really looking at mental health since May is Mental Health Month. We want to look into all of the other May is Mental Health Month activities. You can go to mhanh.org/MHM2021. Lots of great stuff happening both from our organization as a whole and throughout the country. So definitely keep an eye on that. My name is Carolyn Quinn. I am the Director of Community Engagement and Wellness Programs at the Mental Health Association New Jersey and Atlantic County. I have been there for over 8 years in various roles and really excited to be able to talk about how important all of our mental health is today. The learning objectives for today is really to explore some initial data around COVID-19's impact on mental health, define what we mean by mental health and mental health disorders. And we're also going to explore the prevalence around mental health disorders. We're going to identify common signs and symptoms of mental health disorders and also look at mental health crisis. We're going to outline ways to help someone who may be struggling with a mental health disorder or heading towards a mental health crisis. And we'll also look at identifying some wellness techniques and strategies overall to take care of someone's physical and mental health, really with this idea that we all could use some self-care. So who are you? Close your eyes for a second and really think about, how are you? We have been in a global pandemic for, oh gosh, what is it, 16 months? I don't know, forever it feels like, right? And think about this statement that we say, how are you? How you doing? It's often a way that we say hello. However, it's also a way for us to ask people, how are you? And if you've ever asked someone, how are you? And they say anything other than fine, good, or something to that effect, if there's really more than 2 words coming from that person, we're almost in shock, like, oh, I didn't ask that, but we did. It's a way that we check in with people. And one of the best things we can do is check in with how people are. It is important for us to check in on how we are. It is important to be able to connect with people and have that, support around, giving support and receiving support. And it's also important to check in on how other people are. And what they have found, that from January to June of 2019, how are you truly for adults was that were maybe struggling with some depression or anxiety. And then they asked in January of 2021, this year, and asked, how are you? And they were over 40%. Now, I can't help but think that there is some sort of connection to this global pandemic and these results. Now, this is just one study. It is based on, who they were able to and all of these techniques. But I think, this is from the Kaiser Family Foundation, that there's preliminary research telling us people doing, but how are you? And being willing to listen. And also ask ourselves that too. So a little bit more about this, and this is among essential workers. So imagine all of the essential workers in your lives, and really can be many different folks that we've learned out and that are deemed essential workers. Think, of course, all of our medical friends. Think about all of our public safety folks. Think about all of these other small details in our life that are considered essential for us, even despite a global pandemic. They are seeing that there is an increase in symptoms of anxiety and depression. There is looking at an increase of substance use disorders. And look at that one specifically. So we've got, and remember, this is almost a year ago, June of 2020. But think about this. Our essential workers are seeing a 25% of the folks have started increased use in substance uses to cope with the stress of the emotion related to COVID-19, compared to 11% of our non-essential workers. Now, I'm going to say that everyone is essential in our eyes as friends and things like that. But when it comes to essential workers based on the pandemic, we are seeing that our essential workers are much more potentially affected by their mental health. The other one I really want to focus on is seriously considering suicide in the past 30 days. Our essential workers were at 22%, as opposed to our non-essential workers were at 8%. So there's definitely a need to be checking in with our friends and family that are essential workers. Now, that's not to say that our non-essential workers aren't also in desperate need of asking that previous slide, how are you? But just to make sure that we're especially checking in with some of those essential workers. And this is my last slide of statistics. And this is looking at race. And, race has been something that really has come up throughout this global pandemic as well. And overall, we're seeing that adults as a whole are 42% sharing that during the global pandemic, they're experiencing symptoms of depression and anxiety. But when we look at other non-Hispanic, Black, Hispanic or Latino, our friends and family of color are higher than your average adult in comparison to non-Hispanic white and non-Hispanic Asian. Again, this is one study. This is, again, by the Kaiser Family Foundation. And all of this, if you're not a math person, good news, this is my last slide about it. But this is really just an opportunity to remind folks that May comes around every year. We talk about mental health every single year, and it's a great opportunity. But I have found as a provider of mental health services that since the pandemic that we're talking about mental health so much more often, almost like every month is May. I don't know about you, but the weather of May come, November, December, January would be wonderful. But we are talking about mental health around the year. And so really keeping in mind that it's important to be talking about it. And these stats should be really saying to you that it really is an opportunity to talk about mental health. So there's no health without mental health. Our agency has been very involved in doing work around public safety, law enforcement. And I often will go and talk to a large room of police officers and say, after talking about how to support our consumers of mental health, and say, you have mental health. And, I often get all kinds of responses. But the idea is we all have mental health. We all have physical health. I'm sure we can all sit here and think about, oh, yes, I need to watch what I'm eating because of my cholesterol, or my blood pressure's up, so I really need to make sure I'm exercising more, or whatever it might be. We're all very aware of our physical health. We're all very potentially open to sharing how we're feeling and doing with our physical health. But are we talking about our mental health? Are we talking about how we're feeling? Are we attending to our mental health? So when I say mental health, what the heck do I mean? Mental health includes our emotional, our psychological, and social well-being. It affects how we think, how we feel, and how we act. So I sometimes will sum it up in that mental health really affects all areas of our life. It helps determine how we handle stress related to others and make choices. It's important at every stage of life, including from childhood and adolescence through adulthood. Over the course of your life, you can experience mental health challenges. Your thinking, mood, behavior can be affected. And many factors have been found to contribute to that. There are biological factors, such as our genes or the brain chemistry. There's life experiences, such as trauma and abuse. And there's been a lot of research focused on trauma and abuse and how that can affect someone's mental health, especially early experiences of trauma. There's family history of mental health problems, a little bit of those biological factors when we talked about genes. There can be hereditary pieces. Mental health problems are common, but help is available. People with mental health problems can get better and many recover completely. So there's so much hope out there around mental health. Mental health problems affect everyone. So if you are thinking, yeah, this is great, May is Mental Health Month, I'm here, I'm listening, I have some folks that, have been affected by the pandemic, but they're fine now. The bottom line is mental health problems are very common. When we look at adults, we're looking about 1 in 5 adults experience a mental health issue. I don't know about you, but most people I know at least 5 people. So statistically, they know someone that has a mental health disorder. 1 in 10 young people experience a period of major depression. Think about the school sizes. If you have a child or family member or neighbor that is in school, those school class sizes often are 20, 25, 30. So that's more than 1 in 10. 1 in 25 Americans live with a serious mental illness, such as schizophrenia, bipolar disorder, or major depression. In addition, suicide is the 10th leading cause of death in the United States. Now, this is based from 2014. There has been bouncing around changes in suicide with the order in which it is the cause of death. For our young adults, it has gone from 2nd and 3rd, back and forth a couple of times. So overall, we know that suicide is unfortunately common, and we are losing 40 to 45,000 Americans, just Americans, each year from death. And it really can be preventable in many instances, and we'll look a little bit at that as well. So I could sit here and spend another 10 slides talking about signs and symptoms, but I wanted to let some artwork from Mental Health America, our parent organization nationally, do some of the talking. What does mental illness feel like? A tug of war with yourself. What does it feel like? Everyone else has it together except me. I think that is something that social media has helped perpetuate for sure, and something that many people can relate to. What does mental illness feel like? Constantly chasing a normal life. What does mental illness feel like? Looking okay on the surface, but furiously treading water underneath to stay afloat. I think that's a nice reminder of we don't know what folks are going through, and why it can be so important to go back to that first slide I shared with you. How are you? Anxiety feels like it's always raining and I don't have an umbrella. What does depression feel like? A terrible sinking sensation. Psychosis feels like you had a brain transplant and nobody told you. Psychosis isn't something that's talked about as much as maybe depression or anxiety, but psychosis is a symptom that can be found in disorders such as schizophrenia, schizoaffective disorder, potentially bipolar disorder. And it's where someone has lost touch with reality. So that's what they're kind of talking about with psychosis. Often you can see delusions and hallucinations as a part of psychosis. OCD, or obsessive compulsive disorder, feels like a daily battle with my own brain. And you can see the brain asking, what if, what if, what if? Borderline personality disorder feels like a rug always about to be pulled out from under me. Bipolar disorder feels like knowing you have all the pieces, but finding it impossible to remember how to fit them together. And those are just a handful. There are many others. I encourage you to, look up or, take part in the hashtag mental illness feels like, to take a peek more so. I want to introduce you a little bit more, going back to that first slide I had about how are you? And this is a conversation about mental health does not need to be awkward.
I'm Danny. I've lived with depression and anxiety for about 12 years. And today,
I was going to put in the chat confirming that you all can hear it. Unmute if you can't hear it, but I guess I can't click on the chat while the movie's playing. I apologize.
Today, I'm going to be opening up about those mental health challenges with some complete strangers in the hopes that we can start normalizing conversations about mental health. Hi, I'm Danny. Nice to meet you.
I'm Colleen. It's nice to meet you too.
Cecilio, nice to meet you.
How are you?
Doing well, thank you.
I'm doing really good. Yeah.
Doing good. Yourself?
I'm actually not doing so well today.
Okay, that's honest.
Oh, it's all right.
Okay.
Okay. What's going on?
Can you tell me a little bit more about it? Do you feel comfortable talking about it, or?
Yeah, I can talk about it. So I've been living with depression for a long time, and this week has been particularly hard for me. So a lot of people simply just don't know what to say and what to do when somebody opens up to them about a mental health or addiction challenge. And that's really where mental health first aid can be valuable. It teaches people a concrete action plan for starting a conversation and getting somebody the support that they need, whether that's treatment or just a non-judgmental listening ear. So was it a little unexpected when I responded that I wasn't doing well, us being complete strangers until this moment?
I'll be honest, it caught me off guard. You just expect the automatic response of, how are you doing? I'm good.
When you first meet someone, here there's like a huge distance.
I always feel like, how can I help someone else? So, and I know it's hard because you just want to be like, oh, sorry, okay, let me run,
And I don't think people do it because they're inconsiderate. I think it's because they honestly just don't know what to say.
Have you talked to anyone about this?
Sometimes I just don't want to burden. Yeah.
I know it feels like that, but most of the time people want to help.
Yeah.
Like everyone kind of wants to be useful to other people, so they want to help you. So
Yeah.
don't feel like you're burdening them.
That was really nice.
That's so sweet. I totally wanted to give you a hug, and then I was like, that might be weird, but okay.
No, that was exactly what you should have said.
Myself, I was thinking okay, this person is in need of help. Try your best. Listen to them. Sometimes that's the best thing you can do is just listen.
If you had cancer, you wouldn't just try to you wouldn't will yourself to get better with that. And so I hope that people just start talking about it more.
Wouldn't it be refreshing if we could take off the mask?
Yes, absolutely. Be real people.
So how did you learn how to respond that way?
My father committed suicide when I was young, and it was like a really pivotal change. And I think I spent most of my life trying to avoid that and avoid talking about that and the shame and the guilt. So I really made this decision to like learn how to interact with people and be empathetic and show people that someone does care about them even if I don't know you. I think people should just ask more questions, because it's like once you get to know the person and understand that it could literally be any of us, like any of us could have this at any point in our lives, it just, how could you make a judgment on it?
Can I give you a hug?
Well, absolutely. I love hugs.
Thank you.
So just a quick little video, and if you are ever interested in mental health first aid, it is a course. They offer it both in person as well as they're doing some kind of virtual pieces as well right now. If you're interested, please feel free to put your email in the chat, or if you're watching this later, to contact the Mental Health Association. I think whether you take mental health first aid or not, it's a really great story and video to take in mind to really just check in with people. Mental health help. If you have a friend or a loved one with a mental health disorder, what can you do? You know, and we heard in that video the one gentleman saying that I really think people just don't know what to say. What can you do? You can reach out and let them know that you're available. Simply just letting them know that you're available to listen. Offer to help them access mental health services. Unfortunately, just like finding a physical health cardiologist specialist that is close to home, accepting new patients in your health insurance or at a reasonable cost that you can afford is challenging, as is it to find mental health services, if not more challenging. Treat the person with respect. We don't have to define them by their diagnosis. That's one simple detail about them, but there are so many others. Learn and share facts about mental health. You know, be willing to talk about mental health, whether it be May or any other month, to let folks know that you are willing to talk about mental health. At this point, my hope is that you are really starting to see the value in talking about mental health and how there's many folks that can struggle from mental health challenges. I want to introduce you to another video, and this one is Kevin Hines, and we're going to talk a little bit about if someone's developing a mental health crisis. So another powerful video. It's a little bit longer, but I don't find too many people bored by watching this, so take a peek.
At the age of 17, I developed bipolar disorder, a very severe form. It nearly cost me my life and nearly destroyed my family. My parents were in the middle of getting divorced at the time. It was a tumultuous time for my life as a teen, and I believed that I was the only one under that cloud. But that's so far from the truth, so far from fact. 50 million people around the world diagnosed mentally ill. So many more undiagnosed, but that have the diseases that are in their brains. I don't want to have this disease. I don't want to be flawed. Bipolar disorder, that's not me. I was a wrestling champion in the WCL league in California. There's no way. My football team went to state. This is garbage. And I was in so much denial. And that denial ruled the day until I crashed hard. And it was September 24th when it all came to a head. I sat at my desk and I penned that note. Mom, dad, brother, sister, girlfriend, best friend. Love you, but I gotta go. I was gonna go to the Golden Gate and I was gonna disappear. I thought I was my family's burden. I wish I asked them. I just wanted the pain to stop. That's the common denominator of people we lose to suicide. They just want the pain to stop. What they don't realize is that their thoughts don't have to become their actions. Their thoughts don't have to take over. If you can recognize those thoughts as flawed and illogical, because suicide is an irrational state of mind. You think you have to die, but you don't really want to. You know, I found myself in my father's room that morning. I startled him awake. He looked at me, said, "Kev, what's wrong?" Like with parental instinct. I said, "Nothing, Dad. I just want to tell you that I love you. It's for the very last time." And, you know, he goes, "I love you too, Kev. But it's 6 in the morning and I don't gotta be working till 9. Go back to bed." I walked around to the other side of the bed. I sat on the carpeted floor and I rocked myself back and forth in tears, begging myself to tell the one man who loves me the most in the world the truth. But the voice in my head said, "Be quiet, Kevin, you have to die." And that's what took me to the Golden Gate that morning. I took a bus there, and on that bus, all I wanted to do was scream and beg for help and live. But the voice became so loud. I sat in that bus in the back row, middle seat. I'm crying my eyes out like a baby, mucus dripping from my nose. People staring at me now. Then I'm yelling aloud at the voices in my head. I desperately wanted someone to say, "Are you okay?" I would have told them everything. Fear, apathy. There was a guy to my left, said to the fellow next to him while pointing at me with his thumb, "What the hell's wrong with that kid?" with a smile on his face. Apathy. That's his or her problem, but it ain't mine. The bus got to the bridge. I sat there crying. Bus driver turned, he stood, he looked at me and he said, "Kid, come on, get out the bus, I gotta go." I walked across the walkway of the Golden Gate Bridge for 40 minutes, up and down, back and forth, crying like a baby. Bikers, joggers, tourists, runners, they all went by me. Police officers searching for suicidal people went by me twice. I'm leaning over the rail, crying like a baby. They went by me twice. Nobody cares. And the voice in my head said, "Jump now," and I did. At the millisecond that my hands left that rail, instant regret for my actions and the absolute recognition that I had just made the greatest mistake of my life. You know, falling head first, righted my body accidentally, landed in a position that wouldn't kill me. On the way down, I said to myself, "What have I just done? I don't want to die. God, please save me." And I hit the water. I went down 70 feet beneath the water's surface, but I opened my eyes. My legs, I couldn't move. I had shattered my T12, L1, and L2 lower vertebrae into shards like glass. I had missed severing my spinal cord by 2 millimeters. I swam to the surface only using my arms. When I came to the surface, bobbing up and down in water, swallowing salt water, kept going down, couldn't stay afloat. A woman driving by in a red car saw me go over and she called her friend in the Coast Guard. The reason the Coast Guard got to my body within less than the time I would set in hypothermia and drown was because of that woman making that phone call. The Coast Guard arrived. They fished me out of the water, they put me in a flatboard, they put a neck brace around my neck, and they started asking me a bunch of questions. Guy looks at me, he leans in, and he says, "Kid, do you know how many people we pull out of this water that are already gone?" And I said, "No, and I don't want to know." And he said, "Well, I'm going to tell you. This unit has pulled 57 dead bodies out of this water and 1 live one." I looked up at my dad and I said, "Dad, I'm sorry." And he looked down at me and with great conviction he said, "No, Kevin, I'm sorry." And waterfalls flew from his eyes. He put his hand on my forehead and he said words I've never forgotten. "Kevin, you are going to be okay, I promise." And that got me through the night. Now I had this opportunity to recover. And a lot of people think that I went from this incident and was like, "Oh, I'm so much better now, you know, oh great, it's all gone." No, this was just the beginning. In the first 3 psych ward stays, involuntary, forced in against my will. But those next 4, I found self-awareness. I found the ability to say, I'm gonna accept that I have this disease. I'm gonna fight it tooth and nail. I'm gonna beat it one day at a time. And that's what I've been doing. Exercising every day, eating healthy most days, educating myself about bipolar disorder, being able to utilize all of those things, work them into a regimen, a routine that helps keep me here. The common denominator of recovery from mental illness is routine. There are so many things we can do that are not clinically based for all the people that don't get clinical care. If you can train your body and your mind to wake up at the same time, go to bed at the same time, take your pills at the same time if you're on medication, which helps some people and not all. Train your body and mind to eat at the same time, roughly within a 2-hour period every day. Work out even as simple as 23 minutes a day, that leads to 12 hours of better mood. Your 8-second hugs wherever you can. 8-second hugs release endorphins in the brain that make you feel better. I thought that I had one chance, one choice, and one burden to take care of. I had to die. And I was wrong. Learn from me. Know that your thoughts don't have to become your actions. You were not meant for this world to leave it by way of suicide too soon. But one thing you can never do, one thing you should never do, is silence your pain. I silenced my pain for years. I buried it deep down inside me like so many people do, and I lost myself. And it came out in a burst of rage against myself that led me to attempt to take my life. I want you to learn from me. Suicide is not the answer, and you deserve to be here for you. But your pain is valid, your pain is real, and your pain matters because you do. No matter what you think about how you aren't valued or you're worthless, it's not the truth. You have to find a way to turn back to logic. Logic says that I do get to live, you matter, you're beautiful, we need you. Please, be here tomorrow.
I do want to highlight for anyone struggling or potentially, really feeling that they're having similar feelings that Kevin shared, that phone number 1-800-273-TALK. During the pandemic, the Los Angeles Suicide and Mental Health Hotlines have had an 8,000% increase in use. I'm going to say that again. That in the LA area, their suicide and hotline crisis numbers have had an 8,000% increase in use during the pandemic. So we know that just as those, statistics showed us, that we're seeing an increase in people feeling symptoms of depression and anxiety as well. There is an increase of folks feeling to the point of crisis and potentially having signs and symptoms around suicide. I want to highlight one piece in Kevin's story that just gives me chills every time. I've lost track how many times I've seen this video. When I first met Kevin, I was like, oh my gosh, I need to meet this guy. It's going on my bucket list. And I have had the privilege of meeting Kevin, and he is more bubbly and just amazing human being in person than even in any video or social media pieces you see. He has a book called Cracked Not Broken. He is involved in many different organizations. Him and his wife have the Kevin and Margaret Hines Foundation, who just is doing some really amazing work. So some risk factors that can put someone at risk of experiencing some mental health symptoms and potentially a mental health crisis: distressing and uncontrollable events. Well, I'm going to say that we are all can check that box right now due to a global pandemic. That does not mean every single person who is going through this global pandemic will develop a mental health disorder or experience a mental health crisis. It's simply a risk factor that puts us all more at risk. Stressful or traumatic events, a difficult childhood, history of childhood anxiety, ongoing stress and anxiety. Why it's so important to help reduce stress, because it can lead to developing a mental health disorder. Another mental illness can put someone at risk of developing a second mental illness. We do know that sometimes people can have co-occurring disorders, whether it be depression and anxiety, or it be some sort of mental health disorder along with a substance use disorder. Previous episodes of depression or anxiety can put someone more at risk of developing depression and anxiety again, as well as potentially a mental health crisis. Family history, we've talked about that before. Overall, a more sensitive emotional nature. Illness that is life-threatening, chronic, or associated with pain. So a lot of chronic physical, medical conditions can affect this. Side effects of medication. Think about all those commercials we watch and we hear about all the side effects. One of them is mental health, as well as suicide. Recent childbirth. We are hearing more and more about postpartum depression. Premenstrual changes in hormone levels, and we can see that all throughout a woman's life. Lack of exposure to bright light in winter. So thinking about there's seasonal affect disorder or SAD, and that can affect folks. Chemical neurotransmitter imbalance. So really looking at that biological aspect of things. Substance misuse, intoxication, and withdrawal as well. So there's lots of risk factors. And so quite often, many of us have multiple risk factors that can be affecting us, and why it's so important, whether you live with a mental health disorder or not, that you're taking care of your mental health. So how do we help someone? No matter what, we're going to treat the person with respect and dignity. Think about that person that was on the bus that was so uncomfortable watching Kevin sobbing uncontrollably and talking to the voices that, you know, he had to make that comment, what's wrong with this kid? A lot of times the fear of not knowing what's going on with someone, or the lack of knowledge around mental health disorders, can very much cause someone to not be respectful because they are fearful and unclear of what's going on. Understand that the symptoms are expressions of distress, and it's a part of the illness as opposed to a part of the person, or even how that person feels. When someone's unwell, they are really not themselves in many ways. And so we are going to treat them with this same respect and love, but recognize that they're struggling, and not to take personally what they might say or do. We are going to have realistic expectations. You know, if we say to someone, listen, Kevin, I know you're struggling, go to bed. Tomorrow, you're going to feel so much better and life will be okay. Well, what happens if Kevin goes to bed and he actually feels worse tomorrow? Now he might feel like he's let you down, and it didn't work. So is he going to come back to you? No. So we need to have realistic expectations. Many people get well and stay well for long periods of time, but it does take time. You know, even in that video, Kevin talked about how, you know, people thought that, you know, he got better after his attempt, and that was it. And he talks about how he had multiple hospitalizations after that, and the first couple were involuntary. He still was not ready and willing to recognize that he was struggling and accept that help. So it does take time. And so if you use Kevin as an example, which is a great example of someone getting well, we also need to recognize that Kevin didn't do that in a blink of an eye. We're going to offer consistent emotional support and understanding. So remembering that, you know, if you're wearing your mental health hat one day with support, that tomorrow, if you're having a bad day, or you're in a rush, that doesn't mean that you leave the hat off. It will be hard, I promise you that, but it will help that person and it will help you. Give the person hope for recovery. Provide practical help. Offer credible information. And the biggest one to keep in mind, if someone shares with you that they're thinking of suicide, we must not ever agree to keep their plan a secret. That is the utmost important thing to do. You know, and you can say, I'm so sorry, this is the one thing I cannot keep a secret. And, you know, it may cause the person to be mad, but it is always better to have someone mad at you and alive than someone not mad at you and emotional. So some of this is not easy, and you know, maybe why not all of us always practice this, but it can save lives. You know, we looked at the 2014 statistics of overall suicide being the 10th leading cause of death. This is how we prevent it. Each and every one of us asking people, how are they? Think back to the first video, just simply asking someone how they are, even complete strangers. And if we're seeing someone struggling, doing some of the things here. Resources, absolutely important, because when we say helping someone or noticing that someone's not doing well, that does not mean you have the sole responsibility to cure them. It's actually quite the opposite. It's about recognizing that there's something going on and linking them with help. And so there are so many resources out there. There is the National Suicide Prevention Lifeline number. Something to, you know, keep an eye on in the upcoming years is that quite quickly Congress has passed that there will be a national 3-digit phone number, just like there is with 911 if there's an emergency, or 211 for resources. There will be one related to crisis, mental health, and suicide prevention. So keep an eye on that. It's not here yet, but it's coming. And I think that, to me, the most exciting part of sharing that is that there is a national recognition that mental health is important, that mental health crises can be preventable, and that we all can use that help. I also want to point out the crisis text line. As we, you know, evolve and we now do so much on Zoom and email, it might feel troubling to call a phone number. So there is also the crisis text line, and they will answer immediately. Some of our staff have volunteered with the crisis text line. It's a really great resource to keep in mind. I encourage you to, you know, pause this or take a quick picture and throw all of these numbers in your phone, because you never know when you might need them for yourself or a resource for someone you know. We have the Mental Health Association, the Mental Health Cares line, and that's confidential mental health information and referrals. And so you can give them a call, 866-202-HELP. There's also the Peer Recovery Warm Line. And so that is the opportunity to talk to a peer who has that similar lived experience around mental health, and being able to talk to them confidentially for free. And so that's the 877-292-5588. And that's a New Jersey service. Bottom line, there is so much importance in early detection and being able to identify when there is a challenge, get someone linked with help, and really help promote wellness, because the bottom line is recovery is possible. And my hope in all of this as we celebrate May as Mental Health Month, and please know that the Mental Health Association, we're around every month of the year, but we just love taking the opportunity in May to talk about mental health. But the hope is that you really recognize that, you know, checking in with yourself and others about how they are, and if they're not doing well, linking them with help. If you're not sure where to start, think about getting a checkup from the neck up. Our parent organization, Mental Health America, has these fabulous screenings at mhascreening.org. And it's simple. You can do it on your phone. There are ones around depression, anxiety. There's focusing on different age groups. There is focusing on work wellness. So many different aspects around our mental health. So I definitely encourage you to take a peek at that. And it's a great resource. Save the website, in bookmarks, because again, it's something you never know you might need. And if you have someone that you ask, how are you? And they start sharing that they're not doing well, like that first video, or maybe you are the person on the bus that asks a Kevin of the world, how are you? And they share everything. This is a way that you can say, hey, let's do this together. And they will give you resources and give step-by-step directions of what to do next. So if you're asking someone, how are they? You don't have to have every answer. You have to have a couple of resources in your back pocket and allow the resources to take it from there. And this is it's something you can even text or email to someone. So definitely, take a look at this. And a great opportunity even for all of us to get a checkup from the neck up, just like we all need to get our physicals yearly around our physical health, also looking at our mental health. So in all of this, how do we find wellness? Self-care is so important, whether you live with a mental health disorder or not, because we all have mental health. And so manage and reduce stress. Well, that sounds lovely, but how? And we all have different ways that we can manage and reduce stress. But having a little list in the back of your head, or even written down, or on a magnet on the fridge, of what you can do if you're not doing well. Turn off electronics, go for a walk, do a yoga class, meditate, making sure you get to bed early, journaling, taking a hot shower. Simple things that you can always have at your fingertips to do. I'll sometimes even encourage folks to think about okay, where are you most often when you might experience stress? Okay, you're at work, in the car, or home. What are things you could do in the car? Maybe you can change what you're listening to and put on a meditation instead of the news. If you maybe choose to get off the highway and take a back road, even if it might take 5 minutes longer to get where you're going, could that reduce stress? If you're at work, is there the opportunity to shut your door for 5 minutes? Could you go for a quick walk? If you're at home, what is available to you at home? And just always having just these little tips and tricks. Each one might not cure the stress, but they might just take a little piece of the stress away. And that's what we're looking to do. Developing a strong support system. Really having, that group of folks that are helpful for both you to check in on and have them checking in on you. I think we've really seen that during the pandemic, but whether it be the pandemic or not, having a strong support system. Find activities that you enjoy. I recently saw on NPR, National Public Radio, this idea of when's the last time you started a hobby? And there was no other, reason to do the hobby. It wasn't, I'm going to start, doing yoga because it's good for my health, but just something you enjoy and love. We have such little time on this earth, making sure that we're doing things that we enjoy and are fun. Get enough sleep. And everybody's, enough sleep is going to be different. There is, we could spend over an hour talking about, sleep hygiene and self-care around sleep, but figuring out what is enough sleep and the best ways and routines for you to get that sleep. Exercise regularly. And I will share one of the things that I have found this year is Instead of exercising with this idea of like, I need to lose weight, I need to be a certain way or whatnot, that I have found that I think about, I'm going to move my body because it's what's good for both my mind and heart. And that's actually motivated me more. A healthy diet. And everyone is going to define that differently, but finding a way to make sure that you're nourishing your body with what you're eating. Have effective coping and problem solving skills. That kind of goes back to those lists of activities and things that you can do to help reduce stress and improving self-esteem. And really, you know, all of these bullet points could be another, you know, hour community ed workshop. And maybe we'll work towards, you know, covering some of these. But the bottom line is making sure that you are finding wellness so then you can do the rest of your responsibilities and support others. For the most part, that's pretty much our time for today. Is it's almost the end of our hour, but these were our learning objectives: to explore initial data around COVID-19's impact on health. I think we looked a little bit at that. Defining what mental health and mental health disorders are, as well as prevalence. Identifying signs and symptoms of mental health disorders, and also looking at signs and symptoms of a mental health crisis. Outline ways to help someone who may be struggling with a mental health disorder or a mental health crisis. And I think we spent a good amount of time really looking at that, watching those videos around that, and really thinking about what you can do to make an impact in your community and world, as well as identifying wellness techniques. We can't do any of those other outlines of supporting folks if we're not taking care of ourselves. So it has been a pleasure to go over this today. It is Mental Health Month. We are really trying to just, you know, flood social media with positive messages and letting people know about May being Mental Health Month. We even have some swag that you can, you know, check out. I've got my brain shirt on. I don't know if you can see that, but that's there. And it's Mental Health Month. You can be a mental health advocate. You can stop the stigma. My request of anyone, whether you're here today or if you are watching this later, is take what we talked about and talk about it with others. Talk about mental health, share with everyone about how you are and asking how they are, and knowing that you always have a resource with us at the Mental Health Association. Please stay in contact with us. Let us know how we can best support you and your community, and stay well.